Hello and welcome to the Reactive Dog Pod. I am your host, Tess Morgan. I am a multi-certified dog behavior consultant who specializes in the treatment of reactivity in dogs. Through my business, Treat Yourself Dog Training and Behavior, I help clients make progress and enjoy life again with their reactive dogs. Join me and my guests as we dive into all things reactivity. We'll explore behavior concepts, talk about real-life training plans and considerations for reactive dogs, provide tips and tricks, and discuss how we can best help reactive dogs and their families thrive. Because reactive dogs are good dogs, they just need a little bit of extra support. Let's get into it. Attention reactive dog families. This episode is a must listen for any reactive dog parent because today we're talking about the relationship between your dog's health and their behavior. We'll be discussing the role your veterinarian plays in your reactivity progress, types of vets that might be involved in treating your dog's behavior, the impact of pain or discomfort on reactivity, and why collaboration between your vet and trainer can be vital to your success. Our guest today is Dr. Christina Lucas. Dr. Christina Lucas is a veterinarian and certified professional dog trainer living in Woodstock, Ontario. For 2 years, she has been operating her own business, Be Well Dog Behavior and Training, working full-time, not in a clinic practicing medicine, but offering behavior and training support services while continuing her education and behavior. Christina is passionate about educating guardians and other professionals about behavior and learning theory, as well as bridging gaps between the dog training and behavior world and the veterinary and animal health world. Welcome, Christina. Good to have you here. Thank you for being here.
Thanks for having me.
So my first question is about your experience kind of coming out of vet school and then transitioning to behavior and training. So you completed vet school and then you pivoted to the behavior and training world where you are still working today, which is part of the reason I think you're such a great person to talk to about this topic. Can you tell us a little bit about your education and experience as a vet prior to becoming a trainer and behavior consultant?
Yeah, so I completed vet school and then I worked for a short time in small animal general practice. And during that time, I really realized that I was more passionate about behavior than I was about general medicine and general practice. My interest in behavior had been growing while I was in vet school, and especially towards the final years when I had the chance to work alongside a behavior consultant and trainer. And I also realized that the clinic setting presented some barriers to my being able to support guardians with behavior concerns in a vet role and combine those things. It was hard to have the amount of time to have conversations in an exam room, and it was a challenge to make the services affordable, to also be able to go over hands-on things and demonstrate any type of training mechanics or activities and all of that. I also, as I was in, I guess, the real world, actually seeing clients and doing these wellness appointments, especially where I was realizing just how much behavior supports are needed for our area and the public. And I wanted to be able to help provide that because I felt it was a really important part of being able to protect and improve the welfare of our companion animals and improve their health, because health of our companion animals is not just about that they're not vomiting and having diarrhea, but also that they have a good quality of life, their stress is regulated, that they're not having a high level of stress and fear on a daily basis.
Yeah, there's a lot of good points there. And I also what popped out to me when you were talking about being able to support people is like when I think about my reactivity clients, like the ones that make the most progress, we're in touch so often. We're talking about like every minute detail of their routine and their day and like going out with them and all that stuff. And that's so hard to do in a clinic.
Yeah, for sure. Even with medical issues, it's a challenge to work with your vet and follow up and check in at a frequency that is helpful when you're dealing with chronic issues and long-standing issues, and you need that ongoing troubleshooting or encouragement even. um so yeah, it's definitely a challenge with the formats of most of the practices and the schedules and the workload that's on the vets and the time that's allowed for appointments to be able to cover those things.
I swear I use the word troubleshooting like every single every single day when I'm talking to my clients because it is so much troubleshooting just day to day, right?
Yeah, for sure.
I've been asking all of my guests about their own personal experience with reactivity because I feel like almost everyone I talk to that has a special interest in reactivity has had a reactive dog at some point in their life. Do you want to share a bit about your experience with reactivity, either personally or professionally or both?
Yeah, so personally, I've shared my life with a couple dogs with really severe reactivity. And the first one was actually the first dog I adopted as an adult. And my experiences navigating her reactivity definitely helped shape my interest in behavior and kind of stoked the fire, I think, for providing the behavior support services that I do now, and also deciding how to structure those services and what type of support I wanted to be able to provide. It definitely was a really big and impactful learning experience in a lot of ways. And I think back all the time to the behavior support that I had with her and what I liked about it and what I felt could have been even more helpful. There's lots of barriers to being able to meet people where they are and, you know, make services accessible and affordable, but also provide a really significant level of support. So I try to keep those things in mind, um, with my own experience in perspective. And though like my personal experiences definitely help me relate to my clients, I am careful not to draw too many comparisons or bring personal bias into their cases, which I think can be tricky to do because it's easy to
Mm-hmm.
draw too much from our own experiences for sure. But I do try to do that because these reactivity cases, I mean, it's such a big umbrella term like reactivity, and these dogs that are struggling and have really big feelings. It can have so many layers and individual factors when we're looking at causes and how to support them. So I really try to work with each client and gather a thorough history and explore everything that I can about what's going on with their environment and their dog before making any recommendations.
I want to pivot now to kind of our work as behavior consultants and how we work with vets and kind of the interplay of the two roles there when it comes to tackling a reactivity case. So I think a lot of people, especially if they're just like brand new to reactivity, wouldn't even consider that their vet would play a role, and they would just look at it as like, this is just a training issue. And why would I even contact my vet about this, right? I
Mhm.
find that a lot with my clients that if I ask if they've talked to their vet about the behavior, oftentimes they're like a little bit taken aback because they haven't even considered that. And so we do often, working with these cases, collaborate with either primary care veterinarians and or veterinary behaviorists to help dogs in our care. So I wanted to talk a little bit about what role a client's vet plays when it comes to addressing reactivity.
Yeah, so this is something that I am really passionate about, helping people realize the connections, like you're saying, between behavior and medicine and physical health, because historically training has been quite separate, I would say, from medicine, practice of medicine, and the things that you would go to the clinic for or talk to your vet about. Um, so, as we're learning more about behavior and all of the different reasons that a dog would be reactive, we want to look at whether they have any sort of underlying physical discomfort or medical condition, because just like with people, when we're not feeling well, it can change our tolerance level and how easily we snap, kind of, which is a lot of what's happening for the reactive dogs. It's also going to impact how they're able to learn or improve when we're moving to the training side of things and trying to change the dog's behavior and help them learn new skills. So we do really want to make sure that they're feeling physically well, because it is going to be a big barrier to progress and changing those behaviors in a humane and ethical way, if they're not actually feeling physically well.
Mm-hmm. Mm-hmm.
So I think it's great when clients, vets, have questions in their regular history that they would ask about behavior things, but sometimes they don't. Sometimes you know, these appointments are really quick and it is going to cover, if there is anything really obvious, they're going to do physical exams. They're going to ask about like vomiting, diarrhea. And if the client brings anything forward, then they'll go over those things. But definitely, as a client, bringing forward specifically your behavior concerns that you're seeing with your dog is a really great way that guardians can advocate for their dog's overall health and include their vet in the process, even if they're also working with a behavior or training professional at the same time.
Mm-hmm. Mm-hmm. I always think about like the analogy, like I think it makes sense to people when you make the human analogy of like if you have a headache or you have chronic pain and you're having a bad pain day, of course you're not going to tolerate, that fight with your partner or that thing that triggered anxiety or whatever it is
Mhm.
day to day. So it totally makes sense when you think about it from that human perspective, but sometimes people kind of miss that thought process when it comes to their dog.
For sure, yeah. And I mean, reactivity can have so many layers, like I was saying. And when we're looking at what all is causing it, it can be not completely straightforward. But when we're looking at the connection with medical issues, I I really like to simplify it just by saying we want your dog to feel physically comfortable and well when we're starting the process. And it can be hard to know if they are, because of the nature of dogs and how they mask pain and mask medical issues. So, having a vet or a behavior professional that knows the right questions to ask and is going to even ideally be able to look at your dog in a low stress situation, can be really helpful. And as a vet in the clinic, they're going to do a physical exam as part of any appointment. But sometimes clients think that when they've had a physical exam and there's no significant findings, that that is like um,
A rule out.
a rule out and like a free pass to my dog is healthy for the next year, or there is nothing possible going wrong at this point because there was nothing on the physical exam. And though physical exams are super valuable, and you are definitely, in my opinion, getting your money's worth for wellness appointments, it is not a complete rule out of of an underlying issue and of pain, especially when the dog is so stressed in the exam room.
Yeah, that's just what I made a note about, is that dogs in the clinic may not present the same as they would present when they're relaxed at home.
Yeah,
Especially when you consider like mobility concerns, right? That's why often we tell clients to like take a video of their dog when they're just hanging out at home, walking around, versus like trying to evaluate their mobility when they're stressed out at the vet.
for sure. It's not going to show up the same way when they're really excited and playing around with another dog or chasing a ball, or when they're a little stressed and uncomfortable, like at the vet.
Mm.
Um, they're not going to act the same way, and they're not necessarily going to let slip any of the subtle signs that might be helpful to think, maybe something's not right.
Mm-hmm, mm-hmm. You mentioned masking pain. I think most people will understand what that means, but do you want to just define that, just in case people don't really know what that looks like in a dog?
Yeah. So when people are in pain, sometimes people will be quite vocal or obvious with their words and their body language about where it hurts. And they might be, you know, visually favoring a certain part of their body, or placing their hand over that part of their body, or any of those things. And while dogs certainly can show similar signs, like they could be limping or have differences in how they're moving, they could be licking at a certain spot of their on their body, or like looking at that spot on their body. um those just aren't things that we see as clearly or as frequently in dogs, even when we draw conclusions based on like how painful we know a condition to be, um, to humans. And we see, oh, this dog must be in a significant amount of pain. And then when we look at those signs that they're showing, or the amount that they're favoring that part of their body, it's just often very minimal compared to what we would potentially expect as a human. So that masking, or that um, hiding of the severity and the degree of the discomfort or the pain, is something that dogs are quite good at, and that's because it's uh, an evolutionary advantage for them at some point to not be showing that weakness to their like other animals around them or predators.
Mm-hmm, mm-hmm. It reminds me, one case that I had like semi recently that was really significant with pain was it was like a little Chihuahua that had been rescued relatively recently from I think it was from a rescue or another person, or rehome. Anyway, he had a lot of reactivity to strangers and other dogs that we were working on. And since adopting him, he hadn't had a dental. And so she took him in for a dental, and he had, I can't remember how many teeth, but a ton of teeth taken out. And his reactivity went like way down. Like it was the most dramatic change I've ever seen actually related to pain. So there's so many different places in the body that there could be pain. Like teeth is a big one, right? If your teeth are
Mm-hmm.
hurting all the time, that's definitely something that could impact how you're feeling day to day and how you're reacting towards things.
Yeah, and I think that's a really good example of something that could be picked up on a physical exam, and wouldn't necessarily be clear to the guardian at home, in terms of the dog's not going to be walking around holding their mouth, and they will still eat. Like there may be minor differences depending on the individual dog, but they could seem quite quote unquote fine.
Mhm.
And it might only be in the physical exam when the vet is looking at their gums and their teeth that they're able to suggest the level of dental disease that's going on.
Mhm. I want to talk a little bit about the reactivity specifically. So as a behavior consultant, when I think about sending a client to their vet for reactivity, aside from just making sure the dog has had a wellness exam and is up to date on vaccines and all that kind of stuff and has seen their vet recently, when we see a dog who suddenly is reactive, where they were never reactive before and suddenly they've become reactive, it isn't necessarily a medical issue, but I always want to rule out that there isn't a medical reason for that. Or if it's just that they were always like a certain level of kind of reactive and then suddenly they're way more reactive. So there's a sudden escalation. And so I think that's something that like is always a red flag for me, is like, is the reactivity something that's always kind of been there and it's been at the same level, or has it like suddenly got like shot way up or developed out of nowhere?
Yeah, for sure. When we're trying to answer that question of, is the problem behavioral or is it medical? Definitely the age at onset and the speed at which it shows up can be a big red flag for medical being higher on our list of
Mhm, mhm,
suspicion. Um, and when you said ruling out pain or discomfort, I think that's something that I touch on with any of my new clients with behavior issues, in terms of, even if their vet isn't having concerns from physical exam, or the history that they've collected, and even if the guardian, when I ask them specific questions, doesn't have information that leads us to suspect medical, I still tell them that it is very challenging to rule out pain and discomfort and medical issues, because we cannot ask the dog, how are you feeling? Where does it hurt? What's going on inside?
mhm,
So we can do those screening questions and physical exam as a first line thing. And that can be really helpful in lots of cases for starting to get a picture of what other things we might need to address for their dog to help with reactivity. But it definitely isn't the end. So we unfortunately don't get to say, oh, this is just behavioral and all I have to do is train with my trainer and everything will be fine and I won't need to go back to my vet.
mhm, mhm. Um, uh, when we've done that physical exam and the vet has concluded that there's nothing significant that they're seeing, there's also something that I often see suggested, which is a pain trial. Do you want to talk a little bit about what a pain trial is and what we might kind of get out of that from a behavioral standpoint?
Yeah. So there is a lot of benefit in some cases where we're suspicious of pain, or we'll come back to this in the next question, but if we're not seeing progress with a plan that we think should work, um, of doing a pain trial, which is where we treat for pain with drugs that would relieve the pain and see if we can get improvement in the behaviors for the dog. Um, just because of that masking that we talked about, sometimes it's um, going to be the best way to get information if we treat for the pain and see if the dog shows us different behavior and different um, changes in how they act throughout their day and their routine, or in their training even, because that can be a great way to know that the dog is different, just like your story with the Chihuahua and the dental. Um, they didn't know before doing the dental how uncomfortable it was. It was because of the removal of that discomfort from the dental disease, that they could see this improvement in the reactivity. And especially in cases where the pain or discomfort might come on slowly, I think it's so hard to see any change in our dogs when we're living with them every day. So the pain trial can be a really helpful way to remove the pain if it is there and watch what happens.
Mhm. I think that's important to touch on because a lot of people wouldn't even know that that was a thing that they could ask about, right?
Yeah, absolutely. And I think in medicine in general, even aside from behavior, the treatment of pain is something that is progressing with like the years going on. And even in human medicine, like there's differences, I think, as the years go on in
Mhm.
how significantly they treat pain, and how seriously they take it versus kind of, expecting people to suck it up or
Yeah, yeah,
whatever.
yeah.
So it is something that, depending on the individual vet, they may be more or less likely to bring that up themselves or to suggest it. There certainly can be side effects with some of the drugs that we would use to treat the pain. So just like with anything, it's never zero risk. So there has to be that conversation with the vet, and they want to know that there's informed consent from the guardian, and that the risk is gonna be fair considering the potential benefit of finding out for this pet if they're in discomfort or not.
Yeah. And that's why I always see my role as a behavior consultant as like essentially talking to clients about what to ask their vet, but not
Yeah.
suggesting the pain trial myself as not a vet, right? Because I don't have that knowledge to make sure that it's a safe option for the dog and to pick what that pain trial is going to look like.
Yeah, for sure.
The other thing before we move on is you may be sent to your vet to ask about behavior medication for your dog. So I don't think we need to go into every single type of behavior medication. But I just wanted to kind of touch on that because that is one of the reasons you may be talking to your vet if you do have a reactive dog.
Yeah. So sometimes I have clients that have already talked to their vet and may even already have been recommended to try a behavior medication. And then sometimes, like you were saying, we might have cases where the person doesn't know that it would be helpful to include their vet in the process. And either way, between the vet and a behavior professional, there are kind of certain things where we can ask questions to gauge how much the human and the dog are struggling and in what ways, and then draw conclusions about how appropriate it would be to trial some type of medication. There are different options. There are supplements and more natural options. There are also prescription medications that are used daily or situationally. And it is something that I encourage lots of my clients to talk to their vet about, to at least get some of that information. Um, and it's something that can be a make or break for progress with reactivity in lots of cases. And even if it's not make or break, sometimes it's something that people really wish they'd tried sooner once they find out how much it can help with the whole process,
Mhm.
in terms of just like everyone's stress reduction.
Yeah, yeah. Yeah, it's definitely can be a really, really helpful tool. But it's not without side effects, and it's
Hmm.
definitely something that you should talk to your vet about versus your trainer. Um, so I think that's a good place to kind of pivot to veterinary behaviorists because We've been mostly talking about kind of seeing your primary care veterinarian for all of these kind of pain, discomfort rule outs, talking about pain trials and behavior medications and all of that. And many vets have great knowledge with behavior, and they do vary. But sometimes you will be referred by your vet to a vet behaviorist. So I wanted to talk about, like, what is a vet behaviorist and why would you be referred to a vet behaviorist versus just kind of continuing to work with your primary care vet for the behavior?
Yeah, so a lot of it's going to depend on the primary care vet's experience and comfort level with a specific behavior issue, because there are vets who are working in general practice that have done continuing education and extra training around behavior issues, and they may feel fairly comfortable identifying and discussing behavior issues with the client and making treatment or diagnostic recommendations. But whether they have already tried working with that client and then they've come to kind of the end of their comfort level, or maybe that happened quite quickly at the beginning, they are going to refer to somebody who'd be better suited to take that situation on and provide help. And in the vet behavior world, where we're dealing with these behavior issues, the gold standard for that would be a board certified veterinary behaviorist who is kind of like a psychiatrist for dogs.
Mhm. I also often will see clients go to vet behaviorists if they have kind of like a chronic medical issue and they also have a behavior issue or multiple behavior issues. So I think that's where they really shine, is like being able to tackle that case where there's both the behavior and the medical issue kind of going on and being treated at the same time.
Yeah, for sure. I have done intakes with clients where they already know with their primary vet that there is some sort of chronic condition. Like, for instance, they're on a special allergy diet because they have ongoing GI signs that they're trying to manage with that diet. And then they are dealing with reactivity. And for the primary care vet, they may not be as best suited to look at that whole picture together, as well as the specific recommendations related to reactivity and figuring out whether further diagnostics are needed, whether we need to treat both at the same time, and all of those specific decisions. That's something that they can really help with.
Mm-hmm. They also, I think, would be the right person to see, right? If you're trying behavior medications with your primary care vet and maybe you've tried a couple and you're not seeing success. Typically I see clients get a lot of help from veterinary behaviorists in that scenario.
Yeah, there are definitely a couple behavior meds that your primary care vet may be really comfortable with trying and have seen success with lots of cases. But if those specific drugs or those first ones that they reach for and recommend to you don't help your dog, then they are more likely to want to have you talk to somebody else, and it may be worth even asking for that referral, just because at that point guardians are often feeling a bit tapped out from
Mhm.
the finances, the process, the investment, all of that. And it can really be helpful to go up to that level of expertise and knowledge, because it is different, and they're going to be able to reach for options and make treatment plans that are more outside the box.
Mm-hmm. Mm-hmm. And just for anyone listening, most vet behaviorists will offer either kind of a direct consultation with you or a vet to vet consultation, which just means that they talk to your vet. They kind of talk amongst each other, and then they make recommendations, and your vet prescribes everything and does any blood work or testing that is needed.
Yeah, I love the vet to vet options
Mhm.
because it can make it a lot more affordable. And I think that it keeps the team on the same page in terms of
Mhm.
the primary care vet who's still going to be seeing that dog, and then also the vet behaviorist who is putting in their really helpful knowledge and expertise and recommendations. So it's great when that works out for people as an option.
Yeah, I use that. I shouldn't say I use, but my clients use that option a lot. I want to talk about now the actual visit to vets for reactive dogs. We've talked about why reactive dogs might want to work with a vet or a vet behaviorist and what we want to rule out. But some dogs, in fact, many dogs that are reactive, I might even say most, will have a bit of struggle kind of getting into the clinic, being handled by strangers, vet staff, tolerating, blood work or vaccines or any type of handling that is necessary. Um, and that might even be also just getting in and like hanging out in the lobby waiting for your appointment if your dog is reactive to strangers or reactive to
Mhm.
dogs coming in. And so I wanted to talk a bit about how we can make that process easier for people who have reactive dogs, because I know probably most of the people listening that have reactive dogs can relate to this topic, because most people, it's kind of like a dread thing when they know they have to go to the vet because they know it's going to be a huge ordeal. And so we always want to make that as easy as possible for them. So you want to talk about a couple ways that we can kind of help these dogs out?
Yeah, it's like who's more stressed to go to the vet,
Yeah.
the guardian or the
Yeah,
dog?
exactly.
So there's lots of things that we can do, and I think that is a really important thing to look into, learn about, and make a plan with your vet before the appointment. Of course, like different clinics have different levels of um, kind of experience with catering to these cases and kind of putting these things in place on their own. But either way, I have found that most vets and clinics, they're very receptive and accommodating if you ask for things and you advocate for your dog. So some different options that can make a big difference is having some sort of medication that your dog receives prior to their appointment to reduce stress. So in the vet world, they call those pre-visit pharmaceuticals, or PVPs, but that's something that you would give to your dog at home, sometimes 2 hours before your appointment, often maybe the night before that. And sometimes they do make your dog very sleepy and a little bit, quote, out of it. And that can be something that makes guardians uncomfortable to see, but it is something to talk to your vet about. And sometimes when they prescribe it, they will ask you to trial it before your appointment to see how it impacts your dog, because they can give you a dose, but it is individual exactly how it's going to impact your dog. And it can be good to know how you feel about giving it and how your dog responds before it's time for that vet appointment. Sometimes you might give it and see nothing at all. Your dog is just exactly the same. They're just as restless. They're just as reactive. And those are um, important observations to bring back to the vet before an appointment, because if it isn't working at home, then it's not likely to be that beneficial when they're in the vet environment for that appointment.
Mhm.
And then there are strategic things you can do when you're arriving for and navigating the building and the physical environment of going to the vet. One thing would be, depending on depending on the layout of the clinic and the parking lot, it's really helpful to park somewhere that there's less foot traffic and no one's going to be near your vehicle. Sometimes that's easier said than done, depending on like the size of the parking lot in the clinic. But if it's possible to get your car farther away from the clinic doors and the entry and anywhere that people are going to be walking to and from their cars, that can make a big difference. And then if you can check in with the reception staff, either by phone, like calling from your car, or if your dog is comfortable and the temperature allows to leave them in your car, you could go in, or you could have a second person with you go in and check in so that they know that you're there, but then go back and stay in your car until they're ready for you. And then they either call you or have the technician pop out to you in the parking lot, or that kind of thing, kind of like COVID. when um and then that can avoid waiting in the lobby, which is something that is just too big of a roll of the dice usually, and often going to result in reactions because there's going to be somebody coming or going, and you don't know exactly how long you're going to have to wait. So to wait in the lobby is um, probably going to mean your appointment starts off with your dog and you being already triggered and quite stressed. And then once they are ready for you, that way you'd be able to go right into the appointment room. And sometimes the vets will even have entrances like at the side or the back of the clinic that they can utilize in these cases. And that's something that I encourage people to ask about, because it might not be something that they're using all the time, but it may be there, and we want to avoid those reactions.
Mhm.
So that can also be, and then you would just do the same thing in reverse. So not waiting in the lobby to pay, but go right out and like call in with your credit card or something instead.
Mhm. Mhm. And then there's also training that we can do to help these dogs, both to help them feel more comfortable and also to help the vet staff feel more safe around the dogs. And one of those things is muzzle training, right? So
Mhm.
likely your vet staff is going to want to muzzle the dog if there's a risk of biting to protect themselves and their staff. And we want the dog to not have a muzzle thrown on them for the first time in that moment. And then cooperative care training. So you want to talk about some of the training stuff that we can do to help these dogs?
For sure, yeah. So for muzzle training, you can use something at home that is different than an actual muzzle. So even if for your dog, muzzling isn't yet part of the daily routine or something that you need to use for your walks or other situations, if the vet staff need your dog to wear it for safety in the clinic because your dog is uncomfortable with that, then you can train for this even at home without purchasing an actual muzzle if kind of the investment is a concern or you're unsure about like what muzzle to get. And you can use like large containers, even using like loops and practicing your dog putting their nose in and out of a loop. We can add through Tess or I like a resource for muzzle training, because there are some really great ones out there that walk you through the steps for helping your dog become more comfortable with putting their nose into that. But the basics of it is that, they're not putting their face into things or having something touching their face in any other situations. So it can be quite uncomfortable and scary to a dog to have that happen, especially when they're already in a stressful situation at the vet. So doing some work with it at home is a way that we can help, and it isn't necessarily um, a big, huge undertaking that you will be able to take on. Like, you can do 2 to 3 minute training sessions at a time. And even if you just do like a handful in between one vet visit and the next, it might make your dog a bit more comfortable. Cooperative care is something that is where we try to give our dog consent. So the ability to say yes or no to whether they're comfortable with us doing something. And one of the best examples that I give people is the training that they're doing in zoos for procedures for the zoo animals.
So cool.
It's so cool, because if they want to like file the tooth of a hippo, if the hippo can't let them do it, they have to completely tranquilize those animals to be unconscious before they could handle them or do things safely. But with training where the animal is actually saying, yes, I'm fine with this, give me my cookie, more or less, they can do a lot. And this is something that we can do with our companion animals and our dogs as well. And it's something that a trainer can help you work on specific issues like bathing or blood draws or nail trims or whatever it is. And you can take a cooperative care approach as a really great way to teach your dog to be more comfortable with those things.
And before we move on to our next point here, I just wanted to touch on the muzzle. So Christina mentioned like you could practice, like I've seen people practice with like yogurt containers.
Mm-hmm.
I know that Michael Shikashio says to like keep the box for the muzzle in case you need to just practice with the box first.
Yeah.
And also most pet stores will have a basket muzzle. We do want a basket muzzle because we don't want those like really tight grooming muzzles where the dog can't open their mouth and pant. Partially because we want the dog to be able to pant and open their mouth, and also because we may want to use treats and it's harder to give treats when the dog's mouth is closed. And you should be able to find kind of like a more affordable muzzle at the pet store to start with. And then
Mm-hmm.
there's kind of custom muzzles and other options if you need a different type of muzzle, that you could at least get started with a cheap muzzle and then decide
Mm-hmm.
kind of buy that more expensive muzzle down the road.
For sure.
The other thing that I wanted to mention, just in case people aren't aware, is that a lot of vets will offer happy visits. So that's where you take your dog in, you don't have an appointment for anything, you just go and basically get some treats and have a good experience and then leave. That might be harder for, if your dog struggles to go into the clinic, but for certain dogs, it can be really helpful to just have like positive, safe experiences at the vet and then leave.
Mm-hmm. Yeah. So for some cases, definitely good to have a bit more of a plan that you have made with either the vet staff or a trainer, if you're working with one, to really keep the dog within their comfort zone going into that situation. But for some cases, as long as you take out, for instance, the touching or restraint or like really close proximity, or even going into the exam room, maybe it can suddenly be a lot more positive of a situation and the dog is able to stay fairly comfortable. And some clinics schedule these visits. So if you ask them, they may actually want you to pick a specific time of day, or offer you a specific time of day. And often that's because they will pick times that are lower traffic, so that you can maybe walk in and out of the clinic a couple times and they'll be able to avoid a traffic jam situation, which we've already talked about of trying to avoid. And then sometimes they'll just offer it as more of a pop by anytime. Like you can come by anytime and pop your dog on the scale or grab some cookies for them from the jar or whatever. Um, and it is something that can be great to take advantage of, especially if your clinic isn't that far from you, and make a big difference when your dog goes in and out and they didn't have the whole ordeal of um, the examination or any pokes and prods actually going on.
Mhm. Yeah, it's really great. Definitely depends on the dog, how, like the logistics of executing that, but
For
it's an
sure.
option to look into and to know about.
Yeah, yeah. And I would say, like, if your dog is one of those dogs where they are starting to show significant signs of fear or stress when they even realize what location you're going to, like in the car, they're starting to excessively pant or drool or shake, or they are reluctant to get out of the vehicle when you're in the parking lot at the vet, or it's really difficult to get them in the door, then I would say like that happy visit picture that we were just talking about is probably not appropriate. And I would talk to a training or behavior professional first so that they could help you with a plan to break things down a little bit smaller, because it's nice to say that it's a happy visit, but if you pulled your dog in
Mhm.
with the leash, or you had to like carry them in and
Yeah.
they're trembling and then you put some cookies in their mouth, it's not necessarily going to be helpful at all, actually.
No, no, definitely not. Yeah, it's always so sad when you go, like I have one reactive dog that needs like extra support and then another dog that's okay to kind of go in. And it's always so sad when you see people just like forcibly just forcing their dog in through the door, right? Uh,
Yeah.
Definitely not happy. Um, I also wanted to mention that there is a program called Fear Free. That certifies either full clinics or certain staff members in essentially low stress handling and understanding basics of behavior and body language when it comes to a veterinary setting. That doesn't mean that people who are not fear-free certified won't know about behavior, or that like that every vet has to be fear-free certified to be helpful for your dog. But it's worth noting because it is out there, and if you see a clinic that's fear-free, that means that they've likely at least taken some steps to educate themselves in behavior. I want to talk before we wrap up about one thing I wanted to mention was mobile vets. So depending on your dog and your area and your situation, it's possible that looking into a vet who can come to your house, assuming that your dog is okay with strangers coming to your house, um, might be an option if the vet clinic ordeal is just too much. And then I also wanted to talk about procedures in the clinic. So often we take our dog in, we get the thing done, and then we leave. But sometimes dogs have to be spayed or neutered. They have to have a surgery. They have to have a dental. And so they actually do need to stay in the clinic for a little bit of time without you. So I wanted to talk about Christina, how you coach clients to kind of deal with that if the dog struggles a lot in that type of situation and they have to kind of stay there for an extended period.
For sure. So the recommendations I would give are based around avoiding the dog being in the back in a kenneled situation with strange people and other animals and lots of potentially stressful stimuli going around them while they're fully awake and alert, because that can be really distressing for some of our dogs, especially when we know they're already dealing with big feelings about like the sight of another dog, for instance. And so, what you can do, and again, it's really important to make this plan with your vet and talk to them before the appointment. Planning ahead is key because we want to have this in place. What you could do is stay with your dog until they are given their sedation or medication that's going to start to make them sleepy for a procedure. So that might look like you go into an appointment room similar to having a visit, and then they give your dog an injection, they're with you, and when your dog gets sleepy, then they take them to the back, and are able to take them right in to do the procedure, for instance. That means that it would really lessen or avoid that need for them to be kenneled or waiting like in queue for their turn. And you may be able to arrive closer to the time when they need your dog as well versus them waiting in the schedule. That's something that they can advise you about depending on how they schedule these procedures and what your dog is there for. Then when they're finished, depending on the length of time, like whether you're coming back to get them or you were just waiting there for them, you may be able to pick them up while they are maybe not as completely awake and alert and having all the feelings again. Because if they are still a little bit sleepy, and you've discussed with your vet kind of your comfort level and risks that go along with that, you may be able to take them home while they're still a little bit more relaxed, which can be really helpful. And then you could also talk to your vet about other things, like if they have a quieter area where they're able to put your dog before or after the procedure, if they're able to put up any visual barriers, if they're able to use like a noise machine or play music or things like that, which are the same kind of management strategies we use for our dogs in other situations when they're reactive. But at the vet, they may be able to easily set those things up too if you just ask.
Yeah, yeah. And I think a lot of people feel like concerned about asking. And I wanted to make a note about like it's a balance, right? Like we do want to respect that the vet staff are looking after more than just your dog. They have a lot of priorities at the same time. They have a reason for their protocols for dropping dogs off for certain procedures. And we can respect that while also advocating for our dogs politely and trying to kind of work together, because I think a lot of the time it feels like it's one or the other, like we need to just do whatever the vet tells us, or we need to be rude and kind of confrontational with the vet. And doesn't have to be the case. We can advocate for our dog in a way that's kind of firm, but also nice, and as cooperating and working with the vet and understanding their reasons for why they do things a certain way.
Absolutely. And a lot of vet staff are honestly thrilled to hear that a guardian is so concerned about the emotional welfare of their pet. And their heart will sing if you ask them if there are ways that you can help them make this experience less stressful for the pet. And also, it's good to keep in mind it's not just about the stress of your pet, it's also safety for the vet staff. Because if your dog is winding up with their stress level in the clinic and then they have to try to inject something or place a catheter, it's going to be a lot more difficult and there's going to be higher risks of your dog hurting somebody if they're uncomfortable. So when you're trying to advocate for your pet, it's also about um, giving the vet staff information to keep themselves safe as well.
I'm glad you brought that up, because I was gonna say that they, in a way, they should want to work with you, both because they want your dog to be comfortable and also because they don't want anyone to get bitten. So that's, yeah, that's a great point. Are there any other kind of last words or helpful tips or tricks or thoughts that you want to share before we wrap up?
One thing we touched on a little bit, but just that the umbrella for reactivity is very large. So whether you're talking to other dog guardians or your vet or potential trainers, definitely be mindful of the fact that when one person is talking about their experience with a reactive dog or reactivity, it could mean really different things. And when you're looking to get help from your vet, like we were just talking about, remember to talk to them ahead of time, try to advocate for your pet, and um, ask them about options that they can provide, because you are definitely in the best place to explain what your dog struggles with and what you are learning about reactivity and how to help your dog be more successful, and whether your dog might have underlying pain or any of those things. And you can bring those concerns to them. And then if you don't feel like you get the support there, like we talked about, there are other options. There are referrals and all of that. And I am really happy to be able to chat with Tess and record this for you guys. So hopefully people will learn a little bit more about these different steps and things that they could do for their reactive dog, because it's overwhelming. when you're in it and when you're dealing with it. It's overwhelming for us and for our dogs.
Yes, yeah, it's a lot. Thank you so much, Dr. Christina, for joining us this episode. I hope this conversation has been helpful for reactive dog guardians to understand how their vet can play a role in their journey with their reactive dog, and that it has encouraged those of you who maybe were on the fence about consulting with your vet to do so. For more information on where to find Dr. Christina, and we'll also share some of those muzzle training resources as well, you can check our show notes. Thank you so much for being here.
Thanks.
Thank you for listening to this episode of the Reactive Dog Pod. Please make sure to subscribe, rate, and review so more reactive dog guardians can find me. If you need help with your reactive dog, I offer one-on-one support, group training, and an online membership, all available virtually worldwide. Information on where to find me is in the show notes for each episode. Thanks again, and happy training.